This conference will now be recorded.
Hi again, and welcome everyone. This is Marty again at OPCA. Thanks for joining. We're going to go ahead and get started and let people hop in as they arrive. I think what we'll do is, as people are logging in, we'll just go around real quickly and let you all know who's in the room here at OPCA, and then we'll read off who we have on the phone or on the webinar, and then if we missed you, please introduce yourself. So again, I'm Marty here at OPCA.
Carly Hood-Ronick, OPCA. Joan Watson-Padco, OPCA. Priscilla Brodsky-Schreiner, OPCA. And Danielle Sobel, also the same.
Great, thank you. I'm just going to go through quickly who we have, who I can see on the webinar, and then again, if we missed you, just let us know that you're here. I have Anita Burke, Gail Nelson, Jill O'Neill, Carrie, Kristen, Thomas, and then a few folks, I think 2 callers I don't have identified.
Anybody on the phone that we didn't name?
Can everybody hear me?
Yes.
Thank you.
Perfect. Thanks.
Thank you. All right. Super. So let's get started. I think you all heard that we're recording this. We will mute everyone. Please mute yourselves, but we'll also mute you for the duration of the webinar. As you have questions, please put them in the chat box, and we will address them as they pop up. At the end, we will definitely unmute folks to make sure that we can capture your questions either on the phone or through the chat box. There's a few, your audio prompts for your control are there at the bottom. Great. So in terms of today's agenda, we're going to talk about National Health Center Week, tips to be successful. What we're really hoping to hear is from you about what you're doing and ideas. Also, we're going to talk about some resources available from NAC, and then what OPCA has available as well, and then next steps and questions. So if you haven't already seen, the theme this week, or this for National Health Center Week, is celebrating America's health centers. Rooted in communities. Not to take away from the excitement that was last year, I didn't get to participate in Superheroes, but I'm super excited about this year's theme in terms of the social determinants of health and the opportunities to really highlight this emerging and exciting work. I think in terms of just the focus days, I know we've already seen some clinics have events scheduled. These are the focus days that we've seen from NAC. And I just wanted to talk a little bit about them and maybe some opportunities that exist within those. But I just want to say that I don't think that it's necessarily important that you follow this schedule. I think the goal is really that as long as you're engaging, I think that's awesome. And but if there's a way that maybe some of the comments I have perhaps give you ideas for how to engage with these themes, all the better. So the Social Determinants of Health Day, I think, is a real opportunity for health centers to celebrate and reflect on the work that they're doing to better understand their patients in addressing both their clinical and non-clinical needs, and how health centers impact the root causes of health, including patients' health behaviors, health outcomes, and costs to the healthcare system. So as you're thinking through that theme, thinking about how those non-billable things you're doing, those non-codable things you're doing that really have an impact on the root needs of your patients. Monday, Healthcare for the Homeless Day is a great time to highlight our shared work to meet the basic health needs of people without homes, in eliminating health disparities, and the work we all do to end homelessness. It's also a really great time to think and to celebrate the work being done to advocate for policies that end homelessness, that provide comprehensive housing and health care as a human right. I know a lot of work has been done this legislative session around making sure people can stay in their homes, around tenant protections, and a lot of other opportunities. So as you're thinking about this, if you want to work on themes around policy, please reach out to OPCA. We can certainly provide you plenty of tools on how, or highlight the work that's been done around homelessness at the state level. Agricultural Appreciation Day. Health centers have really developed effective strategies to increase access to care for migrant and seasonal agricultural workers and their families. Health centers are really critical to ensuring access to quality primary and preventive care for patients who might otherwise go without care. In this space, I think perhaps something like hosting mobile health screening or a health fair event or organized event with partners in your community where you can specifically reach out to agricultural workers, maybe at your site or at their workplace. Wednesday is Patient Appreciation Day. Let's not forget about the people in our health centers that we serve, but also remembering that boards are 51% consumers, and it's really important to make sure that we highlight those individuals who both live in the community and are served in the health center, as well as are guiding voices for the work that your health center is doing. Celebrating patients and consumer board members who keep health centers accountable and sensitive to their community's needs. Thursday, Stakeholder Appreciation Day. Whether it's your congressional delegation, a member of the state legislature that represents your district, one of your health centers or locations is in, and county, local officials, don't forget people from your health department. Just because you're not county-based, those people play a really critical role in the public health for your community as well. National Health Center Week is really an excellent opportunity to show your appreciation for policymakers at your health center. I mentioned briefly about some of the work that the state has done around homelessness in this most recent legislative session, and I think saying thank you to folks who had a hand in that if they're at your health center is a really great idea. Perhaps providing or asking them to take a tour. Definitely give lawmakers and local officials an opportunity to speak if they are in attendance. And ask them also, a great opportunity might be to coordinate with them or their staff if they would submit a letter to the editor in your local paper highlighting National Health Center Week or the work your clinic is doing. Local papers are always thrilled to have elected officials share their opinion or letters. So maybe you can use their byline to get your paper to promote the work your health center is doing. Friday, let's not forget about the people that make the machine run. Definitely recognizing the individuals who are committed to providing high quality care for patients in need. And then finally, Saturday wraps it all up with Children's Health Day. You know, more than 137,000 children in Oregon get their primary care from a community health center. So what can we do around highlighting that work and that population that we serve? Perhaps things like book drives for your local school, well child checks, fun runs, something just to engage families and the kids that you serve. Certainly, this is that opportunity to do it. So thinking, kind of changing gears a little bit and thinking about the events that you have planned and ideas around how to engage with your community and local elected officials. Just simply opening your health center up as an open house. Don't forget about the folks who you may not have direct relationships with in terms of day-to-day patient care, but these people certainly interact with a lot of the patients that we serve in health centers. Staff Appreciation Day, perhaps a luncheon. Free screenings, I think we touched on that. You know, if you have a social media presence, blogging, Snapchat, Twitter, and Facebook, all a really great way to impromptu highlight the celebration or Health Center Week and the activities that you have. Also, don't forget, if you have, for lack of a better term, celebrity lawmakers or elected officials in, make sure and get plenty of photos, not just of that person, but staff with that person, patients with that person. Great opportunity to highlight their engagement. I know in terms of ceremonies, OPCA has asked the governor for a proclamation for this year, and perhaps you can weave that in. Fingers crossed that we get it. Weave that into a ceremony of some kind. Contests, raffles, and giveaways. Don't forget to partner with organizations in your community, local businesses, who might donate prizes for raffles or other things to engage your community members. I know that there's at least one health center doing a grand reopening, so maybe there's a groundbreaking or ribbon cutting, or even if you're in the middle of a capital improvement project, what a great opportunity to highlight the expanded access to care that you're going to be offering in the future. I mentioned health fairs, and perhaps, again, there's local organizations that you can partner with around celebrating National Health Center Week, because it's not just health centers, it's all of our partners around us that really make us successful. And don't forget, invite local officials and use social media. I will probably sound like a broken record by the time we get done with this about that. So in terms of inviting elected officials, I know that just about every health center that I've interacted with has a relationship with either their member of Congress, legislator. In fact, I can't tell you how many times I have heard from health centers, oh, in fact, they call their state representative by first name, because I know so many of you are closely connected with the people who make the laws that impact your health centers. So thinking about making sure that you invite those people and their staff. Remember that their staff can be just as influential in the decision-making process as talking with the elected. So it's not as, if the elected can't attend, or perhaps they're at a different site or location, don't discount staff as a really great opportunity to showcase the work you're doing. So Health Center Week falls during Congress's recess for the entire month of August. So, and everybody knows that. So the asks for time from your members of Congress, if they haven't already started to roll in, they definitely will be. So now is definitely the time to get started and asking if they can attend. And again, please be sensitive and try to make space for them to make a few comments or perhaps to honor the work they're doing. OPCA would be thrilled to help with ideas in terms of ways to recognize members of Congress or state legislators or local officials for that matter if you need certificates of appreciation or other, if you need us to highlight work that they've done in the healthcare space, we're happy to be a thought partner in that.
Just quickly add to that, Marty. Different from last year because we are not actually in an election year. We actually can let them have the floor, right? Give them some space to make a couple remarks. Let them do that. They do like to have that that floor space, and they're not stumping, right? We definitely are not in that season. We don't have to give that caveat. It was a little different last year in that we had to be a little more careful around how they were invited and what they were actually doing. So ask away and give them that space.
And if you do get confirmation from from an elected official, no matter what level of government, please do let OPCA know. It's really helpful for us when we, from a policy standpoint, are working with those people during legislative sessions or rulemaking periods to be able to highlight the fact that, hey, do you remember the health center you were at in August? This is directly tied to the work that you are making a decision on now. So just let us know.
Marty, I think there was a question that came up in the chat box with you.
Let's see, Kristen asked if we CC OPCA on an invite to an elected official, who specifically? Yes, you can just add me to that email chain, and Danielle also, that ties us in. And as an aside to that, if you're having trouble getting a hold of an elected official or their staff, please reach out to us. Oftentimes we have relationships or perhaps alternate contact opportunities, so we'd be happy to help facilitate that. I've already connected one health center with their member of Congress's scheduler locally, so we'd be happy to be a resource there as well.
And our emails will be at the end of today's slides.
Yep. Being flexible is key. As I said, our members of Congress are out for the entire month of August. Well, with the exception of the Senate's got a couple days right there at the front end of the month. But try to plan around their schedule if you can. And just because they can't show up during National Health Center Week doesn't mean that it's still not really valuable to have them participate. So work with them in a way that means they can participate and that they have eyes and a presence on your health center. And then just to Danielle's point, just a few things to remember. Given we're not in an election cycle year, that makes their comments a lot easier. But do coordinate with them. Perhaps it's even easier if you send them or their staff, when you're coordinating, some talking points that you think, or a way to highlight your health center so that they have a message to work from. Having been a former congressional staffer, I can tell you that it was always really helpful to have the organization where we were going to be send talking points or some background in advance for us to draft comments from. No campaign events or political things. I don't think that'll be a significant issue this year. And then just make sure to let people know, again, that you have contact information for those folks in case of last minute changes or anything like that. And again, I can't stress enough, please give them a few minutes if you can to make comments or to honor them. Shifting gears a little bit, thinking about promoting National Health Center Week and your events. Lots of ways to do that. Social media is certainly a great way, particularly with your members of Congress. They have a significant social media presence. So when you are thinking about your event, and if you've gotten their buy-in to attend, definitely share that on social media and use the appropriate hashtags and or tagging them on whatever platform you're using. We've got a couple social media posts up there in terms of samples. That can all be found at the link to the bottom right on NAC's Health Center Week website. And I'll be sending this webinar out to everyone after this so that you can click the links and copy and paste things as necessary. Super. This is more of a background piece, but is really important in terms of making sure that, one, members of Congress know what's going on. Two, it's always great when NAC knows how engaged health centers in Oregon are, and it also helps OPCA coordinate and track events. So there's a site on National Health Center Week's or NAC's website where you can go in and register your event. We would highly encourage you, or maybe even beg if you would do that. If you have any challenges around that or need help with it or guidance, I've already worked with a couple of health centers to get it done. I'd be thrilled to help you get yours on there. If it just comes down to a capacity or staff situation, I'd be happy to work with you and do the work for you. So whatever it takes. We've already got 8 events registered in the state. That's awesome. We'd love to see that number go up. So however OPCA can be a partner in this, I'd be thrilled to. I mentioned it briefly, but I just want to highlight it again. Lots of photos, lots of videos, patient stories. This year, like last year, NAC is doing a picture and video contest in advance of National Health Center Week, really to help people start to think about and have a trove of media to share. So one example is the poster on the bottom right of your screen, where you can fill in why you value your community health center, and then just get somebody to grab a cell phone picture or maybe even a selfie, and then send that in by tagging at HC Advocacy online, and then that enters you to win a $100 Amazon gift card. So the dates are there, June 21st, and that ends July 30th. So do that, engage a little bit, and then you'll also have some really cool media opportunities to share out on all the days of Health Center Week. You know, we haven't talked a whole lot about the planning part yet, and I know we said start early now, and in terms of inviting your members of Congress, and also figuring out what types of events you want to hold. Thinking about who might sponsor. I mentioned earlier about partnering with local businesses for perhaps prizes and raffles, or other organizations. So thinking about who those local thought partners are that are helping advance the care that you provide to your patients there in your communities. Creating those lists and starting to reach out is really important. Teamwork planning and support, including benchmarks. So this work isn't going to happen in a vacuum, and really is going to take all hands on deck, particularly when you think about inviting local or elected officials, partnering with your organizations in your communities. So think about who might be best suited to do that. Maybe that's putting together a planning committee, and making sure to engage your board around this work and getting their buy-in as well at your health center. I already talked about it a little bit, but that outreach piece, again, inviting elected officials, I can't stress it enough. They just come with so much weight in terms of making sure to highlight your event. That certainly brings people to your health center just to have the opportunity to interact with the elected officials. So invite, invite, invite. Also thinking about who might sponsor your event from food or supply standpoint. And also thinking about letting the local media know that you're hosting events, because there's nothing better than earned media that you don't have to pay for. And maybe that's even asking your local radio station to run some ads because you're doing a health fair, or highlighting that you are doing a community lunch, or whatever that looks like. Local media is always happy to help support, so please reach out to them. If you need help with press releases, media outreach, or any of those things, and you don't have internal capacity, again, that's something that OPCA can help with, so please reach out. Be tenacious and persistent. Your members of Congress and legislators are super busy, and their staff may miss the first email or two. So be persistent. Don't hesitate to follow up on those emails. And again, if you're not getting response or you're not sure where to start, OPCA would be happy to help make that first connection. And then think about keeping track of who attends, particularly from a VIP or elected standpoint, and make sure you thank them after the fact and let them know you really appreciated their engagement in National Health Center Week. I'd really like to kind of just open it up right now to folks on the phone or people in the room around what you did last year, what you're doing now, what kind of successes think. Does anybody have anything that they would really like to share? Maybe someone that's got an event already on the calendar and what you're doing? Does that mean nobody has anything planned?
Hey, Marty, this is Leanne at Reinhardt Clinic. We will have our annual community picnic on Thursday, August 8th. We have a planning meeting next week, so I haven't pinned down all the details, but just as soon as they are firmed up, we'll be posting that on the healthcenterweek.org website. And we always invite all the local elected officials, fire chiefs, police chiefs, and their staff, as well as all the state and national legislators. So we will continue, probably, do that as well this year. So that's what's happening in Wheeler, Oregon.
That's awesome. Thank you for sharing. I just wonder, is there anything you can share that you found really helpful, or perhaps challenges that you've had to find workarounds to as you've been planning, either with inviting your elected officials or from a structural or scheduling standpoint?
Are you talking specifically to Reinhardt Clinic or everyone?
Oh, I mean, I would love to hear from anyone if you're facing challenges, what successes, but certainly also Reinhardt, if you have anything to share that might help your peers.
I guess one of the challenges that we've run into in the past is the timing of National Health Center Week. We have, when we try to hold larger community events, it's shortly before school starts, and we find a lot of people are out of town. So that's one challenge that we've had. I tend to go old school and do written invitations to everyone on our database, all of our community partners, everyone. And that actually has seemed to work fairly well. We don't get a lot of people who show up, legislators who show up, but I tend to get responses saying thank you for the invitation. Sorry I can't make it, but Anyway, we're a little old-fashioned, I guess, along those lines. But maybe I'll try email this year.
Now, and Leanne, I think that's actually a great tip, right? That especially for the community and for, elected aside, I know we are stressing that a lot, but that's, again, just to encourage you all to get folks there. But your community, all of your, I think there was the fire department, various folks, it makes sense, right? And it's a really cool idea actually to remember that sometimes does work and still works. And then on the elected side, like Marty said, if there is anything we can do to help, or again, getting you in contact or using the contacts we have, we're always happy to do that as well. But that's really cool to know that actually works. And again, handwritten notes still mean something.
Right. Thank you.
Or at least, on paper, whether they're handwritten, but.
Does anybody else have anything that they're working on, wherever you're at in the planning process, that you'd like to share? One of the things that just struck me in terms of reaching out to local organizations, fire department, police department, water department, whoever that is, there is nothing more that kids like than to crawl on big trucks. And maybe that's a really neat opportunity to partner with some of those organizations around like a big truck day, or maybe that's for the Saturday to highlight children's health. But what a neat opportunity to, maybe the fire department will come spray some water and that'll be really fun to watch. I don't know, but I'm a little older than a kid, but I still really like to watch fire trucks go up and down the street and get to sit in the big seat. So that's just one thought that struck me as we were talking about it. One more opportunity if anyone has any ideas to share, and then we'll move on.
Well, I think, oops, comment there.
So we got a comment from Kristen. She says, multiple days with multiple activities planned, a health fair focused on kids, sharing gifts with homeless. I think that, a van run with clients to come to the medical clinic. Wow. Celebrating staff, a video presentation. That's something I didn't mention, but how much fun would it be to spend a little bit of time maybe highlighting staff in quick little snippets of video or an interview to play on Staff Appreciation Day. Really neat. Providing breakfast, board members, let's see, celebrating with community partners and vendor booths. What community or local business wouldn't like the opportunity at your health fair or in your parking lot to highlight themselves? And again, what a neat way to just bring more of the community together and advertise. That's a really great idea. Partnering with your farmer's market to highlight healthy eating and food insecurity. Wow. I think perhaps you could have just done this whole webinar in terms of ideas. Thank you for that. Anybody else?
The only thing I might add, Marty, as well, and Kristen, that is an incredible amount of work and stuff that you guys are doing. Again, health centers can do multiple events, one event. You also can do internal events, right? So if you also are looking at this week and thinking, I can't possibly do something in August, or actually even to Leanne's point around, that's a really hard week. Please know it's also appropriate to host a staff lunch, or I know that actually Central City Concern in the past has often done a blog over National Health Center Week. Again, so based on what your capacity is, and what your timing is in everything else that you do, it's also appropriate to call those out as events for National Health Center Week, right? So if you are just going to host a staff luncheon, or you're really going to focus on staff this year, I think actually Siskiyou did that last year, please let us know. Please post those up for NAC as well. Those still count. And I would also say if they're outside of the week of National Health Center Week, right? So if you happen to have something that needs to be the week before, or maybe it's the end of August because you are doing like a back to school events. In fact, I know there was back to school backpacks that were given out down in the Southern Oregon area as well last year. Count those, right? They don't have to be just in this week. And again, we will count them as OPCA as well to say, hey, you guys did all of this all month long, even in July, whatever that looks like. But again, anything counts. It's really just about that time where you get to recognize the work you do, you get to promote the work that you do, and get out in the community, again, both with your electeds or just in your own communities to demonstrate that value.
Thanks, Danielle. Yeah, I really appreciate that those comments, and particularly it doesn't have to be during National Health Center Week. Whatever work you're doing in your community for the month of August, please post that on NAC's website and also let OPCA know. So highlight OPCA a little bit here. So we are doing our own staff appreciation internally. Perhaps we're going to ask everybody to wear blue. So what is your health center doing around, I know last year we had capes. That's the example I left up there from last year. But what perhaps theme can you put together to engage your staff on Staff Appreciation Day? Or maybe it's every day, so that it's not just your staff, but it's that patients know that, wow, all of these people are here as part of my care team, or your board or other organizations that are on site realize the span that your health center has in terms of workforce. So also, OPCA staff, we are engaging here and offering staff the opportunity to get out to health centers and participate in events, not just from the sidelines, but as volunteers. If you, as a health center, would like to have another set of hands, please reach out and let me know, because, again, we're encouraging staff to get out, and we'd love to direct people where they can be most useful. So if your health center would like to have an OPCA person on site for an event, please reach out to myself or Danielle. I mentioned earlier that we've asked the governor's office for a proclamation proclaiming National Health Center Week, August 4 through 10. That is in the works, and we'll let you know more about that. If it happens, we will certainly get it out to you as quickly as possible so that you can incorporate that into your planning if you would like. I can tell you that given the submission day and the timeline, we hope to have an answer by, I think, the 28th of July would be our timeline to know whether we'll get that or not. So I will, TBD in terms of whether we're getting that and when it will be available, but that's our target date, is July 28th. I think I would be remiss if I didn't make sure that you have all of the tools available. Again, this will come out to you in a PDF form so that you can click the links. But NAC has a lot of opportunities, a lot of resources. They also have a store that they would like to sell you stuff. But, you know, there's some great banners and some other neat things on there that really have that the tree and the roots and the social determinants highlighted. And I think that those would be some great tools to incorporate if that fits within what you're doing. So don't forget, they are also a resource and that you can pull social media samples from or some other things in terms of swag or other things. So what's next? I think just considering what events work for your health center. I mean, I think we've all heard it. If we've heard it once, we've heard it 1,000 times. If you've seen one health center, you've seen one health center. Not any one event is right for your organization. So, you know, what works for you? Engage as much of your team as you can. You know, I know we're doing staff appreciation, but don't forget that the more people that you engage in the planning and the implementation process, the more excitement you're going to build in your health center. So make sure you pull every idea in and every set of hands in that's interested. You know, I know NAC really wants you to post on their website. what is happening. Make sure you send your events to OPCA. And also, when you're doing your social media posting and you're using those hashtags that we referenced earlier, make sure that you also tag OPCA, because we would love to reshare the work you're doing on our social media pages. That just allows everybody a greater reach in terms of who the audience is and highlighting health centers and the work that's being done. Shameless plug, don't just do this for National Health Center Week. Tag OPCA in all of the work you're doing year-round on social media. It really helps us highlight that with our national partners and at the state level. Again, I know I've said this once. I think this is the last time that this is going to be said. Reach out to your local electeds, and again, we'd be happy to be a resource if that's helpful. And then I can't stress enough, we have capacity, we have staff here. If OPCA can help you be successful in any way, please, please, please ask. There's nothing that you could ask that we won't try to figure out how to make happen, whether that's just being a thought partner or making a connection or whatever that need is. Please, please ask. That is all I have. If there are comments or questions on the phone, or you feel more comfortable putting it in the chat box, or you just want to talk offline and give me a call or send me an email, please do that. I'll just make the last call here for comments or questions. Everybody's unmuted, by the way, so don't be bashful. Well, given silence, anybody in the room have anything, comments? That is it from OPCA. Thank you all so much for participating today. I really appreciate the comments that were shared. I've already looked at the 8 events that were posted on NAC's website. That's really exciting. Please let us know how OPCA volunteers can plug into your events. And we look forward to supporting you for National Health Center Week. Thanks again, and have a great afternoon, and I'm giving you some time back in your day.